Here are the children. Tomorrow's doctors and nurses, writers and lawyers, tomorrow's spacemen. Monday through Friday, lunches are planned in thousands of schools across the country. A good lunch provides from a third to one-half of the students' daily needs.
Food is not appreciated in our society as a whole. We don't pay enough attention to it. We're always trying to make it quick. Microwave, come on. We want it in a package, we want it ready, we want it now, you know, and it has to taste good. And that we don't take into consideration whether that tasting good is giving them the proper nutrition you need to grow hair and strong bones and brain cells and, you know, clear skin and big muscles, whatever it is people want, long fingernails. All those things come from eating nutritious food.
My name is Aurora Brown. This is Keziah, my granddaughter, and then Yamka's my daughter. So that's 3 generations right here. A good friend of ours and a person from my daughter's church passed away last week, and it hit me close to home because this person was grossly overweight, had high blood pressure, and what else did he have?
I think he had diabetes, and he had like chronic back problems, and I think there was something wrong with his heart too.
Yeah, and it just hit me that, you know, that could be me. It could be any one of us.
You have communities within San Francisco that are living what's called a food desert. So these are areas where there are no grocery stores, there's a liquor store. And in the liquor store, if they carry produce, it's really poor quality produce and it's overpriced.
You know, they're not stocking fresh fruit, they're not stocking fresh vegetables, they're not stocking anything organic. And so as the choice pool, right, reduces, and you have the real human need to actually put sustenance in your body, even if it might have long-term major negative impacts, that's what you're going to buy.
Nutrition plays a big part in our lives, and it's very important. And so we have to start somewhere. We have to start with the children, and the school is a good place to start, you know, because I don't know where else they could get it from.
There are approximately 22,000 elementary school students in our district. There are 62 K-5s and 4 alternative structure schools like a K-8.
I worked with the Student Nutrition Physical Activity Committee of San Francisco to do a survey of students and what they're eating. And I kept writing the wrong thing on the surveys because I could not decipher what the food in the prepared meal was. And for some youth, that may be the only square meal they get in the day.
The short-term costs of providing good food for the population will save money in the long run, because you're going to save money from having to treat or hospitalize people with chronic health diseases that could have been prevented with good nutrition. A lot of the practices that children have in regard to their physical activity level and their nutrition status is setting them up for failure in the future. And not so much the far future. Like we used to say, if students aren't eating well or aren't getting enough exercise, well, when they're 50 or 60, they're going to experience heart disease and cancers and high blood pressure. But we're seeing these effects now before they're even 20. So 1/3 of the children in the United States is considered overweight or obese by CDC research. That's an astounding increase from what it used to be 20, 30 years ago.
What's school food? I know where carrots come from.
From shipping by truck.
A factory?
The effect of industrializing food is a loss of quality. It's the first thing that happens is you lose the craftsmanship, you lose the attention, you lose the consciousness to what's being created, and therefore you lose a connection to it.
Schools have decreased the infrastructure within which they have to prepare food. So it's very rare for schools in the United States to actually have full-service kitchen anymore. Most of them have microwaves, And many of them receive their food trucked in from local or regional distribution centers that serve the entire district. Many of them simply get the lunches already prepared, and they heat them up and they make them available to the young people.
And I don't know how many people are aware of the constraints on a district or what kind of budgets they have, but San Francisco pays something like, at least last year, I believe it was 97 cents for a plate of food. I mean, it would be hard to ask anyone on the street to go get an adequate, nutritious plate of food for 97 cents.
For breakfast, I've seen kids eating corn dogs on the way to school with soda and chips. When we don't eat a healthy breakfast, or when we get hungry, our attitude changes, our mood changes, we may get fidgety, or have a harder time focusing. And
so when a child doesn't get properly nourished and they come to school and they're acting out and they're misbehaving and they're not learning well, we might put them into special ed instead. Or we might hire a counselor or a social worker to work with this child. There are costs associated with that. It's expensive. Could it be that if we fed them better, that we wouldn't have all these problems that we're seeing? I can predict that there will be at least half a dozen kids coming into the main office before 10 o'clock complaining that they can't concentrate. The teacher referred them because they're falling under their desk. They're complaining of stomach aches and stomach cramps and they don't know why. And the solution 9 times out of 10 is I feed them. And then they go back to class and I don't hear from them again.
I like chicken. I like sugar snap peas and avocado and that's all. I like carrots. Sometimes there's baby carrots. And I like strawberries.
My concerns as a parent is my daughter overeating and eating too many sweets. I feel since she started going to school, she's been eating more salads because they have a salad bar every day. And the kids really love it. When they first started to have the salad bar, I overheard my daughter calling up her friends, yeah, they're gonna have the salad bar tomorrow, and they're really excited about that. That's another alternative than eating the foods. If they don't like it, they'll eat the salad.
The kids love when I come in for nutrition lessons, and oftentimes we'll make things that they've never tried before. And we like to make a My Pyramid pizza, where we take different foods from the different 5 food groups and we add them to a pizza. And each kid has their own individual pizza. So we may use whole wheat English muffins or whole wheat pita bread or cornmeal crust, and we'll put some kind of tomato topping and broccoli, cheese, vegetables, things like that. And sometimes we get really creative with pineapples or garbanzo beans on a pizza, and kids actually love it.
Because of students coming hungry consistently to school, last year we actually started a program that was promoting a healthy snack for every child every day.
I am a physical fitness leader, a nutritional leader, and a lunchtime monitor. This morning, for a healthy snack, we had blood oranges. A lot of kids were like, well, I've never seen that, so I'm not gonna eat it. But there's orange peels all over the yard right now. So I think that's a good sign. A lot of kids liked it.
Do you have a favorite fruit?
Mango. Mango, bananas, and strawberries, and bloody oranges.
The problem is that none of these initiatives has been scaled up enough to make a significant enough difference to all of the people that live in these communities. So we're able to reach, 20, 30, 40, 100, 1,000, but we can't reach the multiple thousands of people who are poor in this country and who don't have the income or the infrastructure with which to access easily and affordably fresh, healthy food.
We are dealing with children. They are anywhere from 5 years old to 10 or 11 years old. I could safely say that none of them are independently going to the grocery store and grocery shopping for the family, or just pulling out of the refrigerator in the morning what they're going to cook for dinner that night. They're not making those decisions for themselves. So we as the adults in their lives, in many ways, have to make those decisions for them.
I think there is a responsibility of parents and community members to organize around this, but I think that the people with with real institutional power in schools and in districts are really the ones who need to start rethinking this, because those parents oftentimes don't have the time, the space, the economic capital to really pressure the schools because they're already at the lowest performing schools.
Everyone has to take some responsibility, understand what their role is, whether it's the parent, the district, or the federal government. And everyone has to figure out how they're going to make the best of it with the resources that we have. But there are people making these decisions, and there are people who are elected to influence some of these decisions, people that we elect. And so they have an obligation also to listen to what we want for our children and for our families and for our community or for our state.
And also, this is a teachable idea. It's not just related to feeding someone or eating. It's related to our overall health as a community. It's related to our education. Children should learn about how they eat. The lunch itself should be part of the lesson.
Ask your school lunch manager if every child is getting a good lunch. If not, it's time to enlist the support of your local peoplers. Work with your school officials and the state school lunch director in your state's Department of Education.